Hey, I'm Paul Chapman, the director for Restore Hope Arkansas. Restore Hope was started when the governor took office. We had had the fastest growing prison population in the nation for several years. Costs were up significantly. This is post-adjudicated cost, prison, parole, probation. Additionally, we were facing a sharp rise during the same time period of children entering foster care. In 2016, the Annie Casey Foundation even found that we had incarcerated so many Arkansans that we had the highest percentage of our children who had had an incarcerated parent. That'll give you 1 on the ACE test, 4 or more on that test, and things start to look probably bleak, both for physical health and mental health. And there's decades of data on what's called adverse childhood experiences. So that's why that was significant. And so even though we were spending more over this time period, both in incarceration and in foster care and social services, why is there no difference to outcomes? That was really what the governor was dealing with. And so in working with him and his staff, we said there are some communities, very few, but some, who have been able to have population level change in these very complex problems. And the main issue that we have to address as Arkansas is that we all operate in silos. Agencies operate in silos. They have a hard time partnering interagency. The nonprofits work in silos, churches work in silos, vocational programs. We all operate in these silos, and it's exceedingly hard for us to be able to coordinate our actions to be able to address these very expensive, socially and fiscally, these problems like incarceration, foster care, justice involvement. And so that is what we wrote, was the communities that have had impact did so in a way, and it's called collective impact or systems theory. So we've developed a model, and we launched it first in partnership with the governor's office in 2016 over in Fort Smith, because it had the highest needs. And it's a crisis to career model. Let's build a continuum of care that has partnerships in a coalition in a community that can actually get someone out of these complex areas of crisis into stability and then onto the career so that they don't slide back. This is another picture of what that model might look like, where you're addressing recovery and housing and employment and transportation all at the same time. They need to be properly sequenced and coordinated. Here's a picture of the situation that our families are in when we meet them. And in fact, in 2020, we helped collaboratively, we helped about 900 families. It was over 2,000 kids. A quarter of those families were homeless. A third of them had felonies. Half of them didn't have GED. Their parents hadn't earned their GED yet. Over 70% have been incarcerated, jail, or prison. These are tough issues. But here's the thing is in 4 communities, as of the time that I'm talking now, 4 communities now have formed coalitions. We call them alliances. And here are some of those individuals that have all signed a declaration of participation to help 100 families move from crisis to career in their community by working together, sharing data on a compliant case management system. And here are the impacts that those coalitions are having. So you can see employment here. This is a Crawford County set of data that's fairly recent. We do measure 13 different areas. And when I say we, I mean the coalitions measure 13 different areas. It's baked into the case management platform, HopeArc. And up top here, there's a spectrum around employment from bad to good. So 66% of clients in Crawford County during this time period had no job at all. And if you come down here, this is the monthly assessment. After working with these communities, we had reduced that crisis to 23%. So that's great. Here's one from Sebastian County. Sebastian County, let's look at housing. So in housing in Sebastian County during this time period, 40% of all the clients that were met were homeless. And you can see that homelessness situation was reduced to 18%. This allows a community not only to see the role that they play in the wider continuum of someone's journey from crisis into stability and into career, but also it shows gaps and allows that community now to collaborate with real data, not conjecture, on what's wrong and how do we need to fix it. And then you can measure whether or not you're having the desired impact. The big outcome that came out of Sebastian County and is now in these 3 other communities, Crawford, Pulaski, and White now, is the reunification rate for foster care. If a child's taken into foster care in Arkansas, you're probably not going to get those kids back with their family, 42% chance. But in Sebastian County, over 2.5 years now, it's above 80%, just by coordinating the actions that are already there in that community. And so COVID hit in 2020. You can see this is a measure out of the Hope Ark system, how the provider, there are 400 now, there are 444 providers that are on that system. And you can see the transaction, the way that COVID's impacted the poorest in Arkansas, who are most likely to be caught up in the justice system. We had 6,500 transactions or interactions on the platform in 2020. Now there's over 18,000, and that was fiscal 21. In fiscal 22, we're already tracking to 26,000 transactions with no additional investments in infrastructure, case management. And that brings us to, what do we actually need to bring additional help? So access to help and the quality of that help. And there are 4 big development items that have been requested by the partners that are collaborating now, doing things differently and seeing different outcomes. And they are, one is homeless providers in Arkansas are required to use an HMIS certified system. We need Hope Ark to become HMIS certified to allow them to use our system to meet the HUD requirements, but also allow them to put their clients in the system and gain access to that continuum of care functionality, which will significantly increase their ability, their effectiveness of staff that they have, but also the care they're able to connect their clients to. Mental health treatment, mental health, especially trauma-informed mental health and substance abuse treatment, has been key in almost every client. Of those 900 in 2020, every one of them was referred to a therapist, a licensed therapist in Arkansas. And they would use the platform to communicate whether or not the client had showed up, some additional needs, like maybe housing that the client had shared with them that they don't have expertise or the time to deal with, but someone else could. And so we've got to be able to bring these set of tools for the mental health and substance abuse licensed professionals so that they can increase the quality. We can get more health to the clients and increase the quality of that health. Court diversion programs. We partner with several courts and several providers like Adult Ed that do partner with courts in court diversion. And there's a set of reports and assessments and additional enhancements that they need so that they can do what they do better, but also so that other courts could easily implement this in their own areas. And then nonprofits are absolutely key in this human services infrastructure. They play key roles, and yet most nonprofits are struggling to be able to gain access to real tools that allow them to be more efficient and more professional. And so we need to bring that. We've got a whole set of tools, enhancements, and trainings that the nonprofits that we partner with in these 4 communities have asked for. So given this investment, we need to go and hire some staff IT folks. We need some programmers and some analysts that can deliver this and keep up with the requests that are ongoing over the next 3 years to be able to serve these communities better. And so that's what, that's the roadmap for Hope Ark. And we will see a significant increase in the number of clients that get onboarded and the number of service providers that join this platform for the good of Arkansas, so that we can help folks move out of these complex areas of crisis, that we can stop spending on the social services, and that and then they can be working in the fields that allow them to provide for their families, pay taxes, buy groceries, and pursue happiness with the rest of us.